What are the clinical features that are seen in COPD? But this time, I will not gonna tell any of these symptoms. Can anyone tell me the COPD symptoms?
I can try shortness of breath, exercise intolerance, fatigue, and cough.
Oh my god, bravo, that's absolutely correct. And other than these symptoms, the lungs they are hyporesonant, and on examination we can easily clearly listen the rhonchi or the wheeze. Let me tell you that how does it sound on the clinical examination. By the way, do you guys know that what is rhonchi or wheeze? I have also described that in my asthma video. But in this, can we recall it?
A rattling or whistling sound resembling snoring caused by secretion in the trachea or bronchi.
That's absolutely correct. Good job. During the late stages of COPD, the patients also show the evidence of increased work of breathing with the use of accessory muscles, pursed lip breathing, weight loss, and the barrel chest.
I have a quick question. In COPD, two very common terms are used pink buffers and blue bloaters. What are these terms and what are their differences?
Okay, very interesting question. Yes, I can tell you the pink puffers and the blue bloaters, and we can see the differences between them. Let's dig into it. Emphysema and chronic bronchitis are the two of the most common conditions that contribute to the COPD. So, emphysema is also called as pink puffers, and chronic bronchitis is also known as blue bloaters. So, the differences in how the two conditions they affect the body, I'm going to reveal it now. What is pink puffer? Basically, pink puffer it's a generalized term that is used for a person who is thin, has a barrel chest, the cough is absent, is pursed lips with the use of accessory muscles is there, and the heart sounds are distant.
Oh, interesting.
The blue buffers, which is also called as chronic bronchitis, in this the patients they are obese and they have frequent cough and use of accessory muscles of respiration is very common. There is coarse rhonchi and wheezing that can be heard on auscultation, and the patients they have signs of heart failure or which is also called as cor pulmonary, such as edema and cyanosis.
Oh, thank God, now I can understand these two terms.
And basically, the symptoms of COPD is also divided into four categories: mild, moderate, severe, and very severe. So, in mild, the forced expiratory volume is 80% or higher of a particular age or sex, and the symptoms that are noted are cough, minimal dyspnea, and examination is normal. So when it comes to the moderate COPD, so the forced expiratory volume is between 50 to 79%, and the symptoms noted are cough, breathless on moderate exertion, a wheeze, hyperinflation, and reduced air entry. Then the severe COPD shows forced expiratory volume about 30 to 49%, and the symptoms are cough, breathless on minimal exertion, signs of moderate COPD, and possibly of cor pulmonale. And in very severe COPD, the forced expiratory volume is less than 30% or less than 50% with the respiratory failure. And what is forced expiratory volume? I have discussed that in my diagnosis. So let's move forward and crack that what is the diagnosis of COPD.